Microvascular surgery is something we often use to help patients with after they've been treated for a cancer, trauma, or a serious injury to their head and neck. It's about 50% of my job or more, to where we take vascularized tissue, essentially a transplant of a combination of skin, muscle, bones, or all three of them, to help reconstruct a complex defect of someone's head and neck. Whether that be their jawbone, their voice box, or another part. And we transplant it by taking those blood vessels and hooking them up to blood vessels either in someone's face or their neck. Most of our patients, they've either had a history of cancers of the mouth, the throat, maybe complex skin cancer. We also take care of a lot of patients that have had trauma, such as a car accident or other sorts of injuries. And area that's pretty common with us nowadays after people get treated for head and neck cancer with radiation is something called osteoradionecrosis. We take care of a lot of those patients with a variety of microvascular free flap options. So there's about 4 of us specifically who do this. We are one of the highest volume centers in the Southeast and also the country. We do about 200 or more what's called free flap reconstructions a year. Sometimes we're doing it as much as 4 to 6 times a week. Thankfully, we've had really good success here over the recent years with advancements in techniques from the variety of partners that I have. Patients should specifically come to UNC Otolaryngology from a free flap perspective because we have great outcomes, not only from a reconstructive standpoint, but also with cancer removal. And we have the whole package from the start of someone's, say, cancer diagnosis through treatment and afterwards. And after they survive their cancer treatment and the initial reconstruction, we take great pride in, over the following years, doing things that we can do to get them back to as close to normal as they were before their initial injury or cancer diagnosis. An interesting topic that I was specifically trained on and that we're starting to offer here is treatments of osteoradionecrosis. So these are people who have often been treated for head and neck cancer, and they've survived the head and neck cancer with a combination of surgery, radiation, and chemotherapy. And unfortunately, they've developed a serious problem called osteoradionecrosis, where the jawbone starts to degrade months to years after treatment. And for some of these patients, we're able to tailor their treatment to a much more limited free flap reconstructive surgery. So we're not having to do the big bone flaps that have historically been done, and people are often able to have a limited procedure where they go home in a couple days and they don't have to be hospitalized for 1 to 2 weeks as they used to be, and people are having great success with it. Well, I think with microvascular surgery, it kind of brings out more of an art than a science, and so that's kind of one of my favorite parts about it is it's something to where you can really be creative. And since we do so many flaps here and we have a variety of providers, we're really able to tailor which flap is best for the patient. We do pretty much any type of flap that's possible, and we specifically try to choose which one is best for the patient, and we'll give them the best form and function long term.